Hello there and welcome. Studying for the psychiatric nurse practitioner is not a joke. The PMHNP board certification, it is a hard exam, hardcore. Right now, it is your chance. I am going over few of the most high yield topics you need to know for your PMHNP board certification. My name is Dr. Lopez. Make sure you like it, subscribe it. I will always provide you free content. Now, if you want a little bit more, make sure to sign up to our PMHNP Crash Course Review. See you on the other side when you are PMHNP board certified. Join us today. Okay, personality disorder. Another discriminator for personality disorder is age. So if the question says the patient is 16 years old and it calls the patient borderline personality disorder, you can say, no, no, no. If the question says the patient is 12 years old and it says antisocial disorder, you say, no, no, no. It has to be for personality disorder over 18. I'm generalizing here, okay? There is an exception, but let's not even go there. For that purpose, personality disorder, 18 and up, okay? Age is a discriminator. So borderline personality disorder. Examples here. What is the goal of DBT? To decrease suicidal behavior. Decrease crisis. You may get a question of what is the goal of DBT? Okay, so DBT main goal is to decrease suicidality in borderline patients. Which medication has been shown to decrease suicidality in patients with bipolar? Lithium. Which medication has been shown to decrease suicidality in patients with schizophrenia? What's the answer?
Clozapine, Clozaril.
Clozapine, Clozaril. Those are very important. Now, also, lithium can be given to patients with bipolar. Is that FDA approved? I'm sorry, a borderline. Is that FDA approved? No, but you have seen that many times. Now, DBT, who created DBT? Marsha Linehan. She had DBT herself. I mean, she had borderline personality disorder herself, okay? She was a doctor. So it's helpful to ask for journal and diary and keep. Which other condition is important to get journal and diary and keep? I'm trying to find a better way of asking. Okay, which other therapy, not condition, is journal and diary and keep helpful?
Cognitive behavior therapy.
CBT.
CBT.
CBT and DBT. Let's call it CBT and DBT. You know, it's not really DBT, it's borderline personality disorder. So when you hear journal and diary and keep, think of it as CBT, DBT. You know it's not DBT, guys. You know that I'm connecting DBT to borderline personality disorder, okay? In order to what? To make a diagnosis. Stressful event happened. Now I can't see. I can't walk. Stressful event followed by a neurological event. Often in the question, they will say, clear by neurology. You can't just say, my mother died, now I can't see. I can't just say directly this is conversion disorder. It has to be clear by neurology. Hey, Dr. Lopez, I don't find anything else. I'm thinking this is a psychological issue. I'll say, okay, then bring the patient here. Okay, clear by neurology, that's your cue. Patient usually is clear by neurology first, followed by neurological symptoms, blindness, mutism, paralysis, paresthesias, right? And other nervous system syndromes or disorders or conditions, okay? Intervention, therapy first. Do you have a medication for conversion disorder? No. Therapy. Do not confuse conversion disorder, malingering, okay, adjustment disorder, and few others. Conversion disorder is a neurological. Think of it as neurological, clear by neurology. Can't see, can't walk, be followed by distressful event, followed by symptoms that neurology like symptoms. Meant to say malingering and factitious. You will get a question or two or three: malingering, factitious, conversion. All three things. Malingering, I want something. Often money, time, love, whatever it is, they want something. Now they're faking the symptoms, false or grossly exaggerated because they want something. Like vets. I'm giving an example. I'm not saying it's true by any means. Maybe they want to say, hey, I can't walk because they may want a 100% disability. Okay. But there is nothing that says it is a conversion disorder. There was no distress event. There was no rule out by neurology. It would say, I can't walk, but the person is saying walking in the gym, right? So it's got there's something that I was representing. Like my lawyer told me to come to the ED because I got into a car accident, right? So the lawyer asking, it leads to think of malingering. Factitious, two ways. Factitious on me, meaning that I am overly uh, lying, I would say lying, or having physical, psychological symptoms, or intentionally producing ones on somebody else for without external reward. So this is how you differentiate factitious versus malingering. Malingering, I want money. I want time off from work. I want something. Malingering, factitious, on the other hand, is I want something that's not money, that's not rewards. Maybe I want emotional attention. Okay. So the motivation behind factitious disorder is a psychological need to take on the sick role and receive attention and sympathy. Unlike malingering, the incentive here are tangible, right? Or really tangible in the inner psychological needs to drive the behavior, right? So guys got it. Now, factitious on another is a different aspect here that you need to be careful of. Usually the mother is taking the baby, the child to the hospital many times with these weird symptoms. Then in that case, factitious on another, you need to call CPS. Okay, so a person may harm the child physically or psychologically. You must report to CPS. Boom! Yeah. If you're studying for the psychiatric nurse practitioner, it is stressful. It is serious business. You must know high yield content, stuff that's available at your fingertips with unlimited classes, unlimited everything. PMHNP board certification, review courses, question bank, diagnostic tests, flashcards, you name it, we got it at www.mpexamcoach. I'll help you succeed. My name is Dr. Lopez. Can't wait to see you become a PMHNP board certified. Bye now.